Hey guys, welcome to lesson 8 of the Health and Wellness for Older Adults course. Today, or in this lesson, because you might be watching them on the same day, but in this lesson, we're going to look at the medication use in older adults. Okay? So first of all, let's just get some facts straight. Okay, so firstly, older adults are definitely going to be prescribed more medication than any other age group, and most of the people that are prescribed a lot of medication are those who are living in hospitals, okay, or nursing homes and like skilled nursing facilities, and long-term hospitals, long-stay hospitals, places like that, which is probably expected. 90% of those who are 65 and older use at least one medication, okay, one prescription drug, okay. Okay, so first of all, let's look at how is most of this medication even being paid for, especially in the older population, because most of them are on Medicare, right? Or actually they do receive Medicare. Okay, so Medicare Part D is what covers a lot of the prescription drugs in older adults, unless they have, other private healthcare insurance. This is pretty much the main coverage that they have. And for the most part, Medicare Part D is technically optional. Okay, so you can opt in or you don't have to have it. Okay, most people are going to opt in. All right, and Medicare Part D has a monthly premium, and it's usually about $34 or so, $35, something like that. And then they also have a yearly deductible that you have to pay before you can even use it. Okay, and usually the deductible is something around, I think it's like $450. Okay, if I'm remembering correctly, it's something like that. Okay, 450, 430, something along that line. Okay, so they have to meet a yearly deductible before this even kicks in, before they can use these benefits and use their so that their drugs will be covered. And the thing is, not all their drugs are going to be covered, just certain things that are definitely approved. Okay, so what this does is that this is really just insurance for your medication needs. You get to pay your monthly premium and all that. You use the insurance carriers or Medicare's carrier network for different pharmacies that are going to accept it, of course, so that you can purchase your prescription medications. Okay, that's generally how it's going to work. This does actually get a bit more complicated, and really understanding Medicare Part D at its core is beyond the scope of this course. So this is pretty much what we need to know here, but if you do have questions about how Medicare works, I can also help you with that. But let's move on. Okay, so medications are extremely expensive, right? And we kind of all know this. Our medications are so much more expensive for us to access than other countries like Canada, the UK, many of those other countries out there. And there are reasons for this, okay? So first of all, what a lot of the money goes to, a lot of these pharmaceutical companies, they drive up costs like to an unbelievable amount. And I actually want to give you guys, I'm gonna link you guys with some videos that will actually give you a bigger picture of what could actually be happening behind the scenes here, or what most likely is happening behind the scenes here, because this goes a whole lot deeper. But for this particular class, what we are going to focus on is all the different costs, okay, that will make our medications very expensive. So of course the pharmaceutical companies have to make profit, check, right? And then the cost of research and development, check. The reason, well, some of these medications, or a lot of medications, the cost that goes into a lot of these, are what they say the cost is that goes into a lot of these, and what's driving up the cost is not really what they're saying, okay? Because many things like insulin, for example, okay, if they say that the cost of insulin, like the cost of research and development for insulin is just, that's what's driving up the cost, that's kind of a lie, okay? Because their insulin has been the same, okay? There are no new developments in insulin since I think the late 90s, as far as I recall. I believe the 90s, I think sometime in the 90s, they have not, since then they have not made any other developments in insulin. What are they really spending the money on? I don't think it's research and development. More than likely, it is actually a lot of what is driving up the cost on medications is those middle people, okay? The people in the middle, the people that that get the medication to the pharmacies and to the physicians, okay? The people who are in between, they're driving up the cost because they get to mark everything because they make their commission off of all of that, okay? So, but I will definitely give you guys some videos, so maybe you can have some sort of insight on, if you guys are interested, go ahead, it's not going to be required, but that way you guys can have some information if you're interested in learning what is actually influencing medication costs. But anyway, let's go ahead and go through some more influences on medication costs, because all these are going to definitely add up. In many medications, there is a high cost of research and development, okay? But many medications, there isn't. Okay, and then the cost of marketing to physicians and consumers and whatnot, this is what most likely, or more than likely, is driving up the costs, okay, or most of the cost is going to go here. Also, liability of hostile product recalls, lawsuits, things like that, and lobbying costs, which ensure that insurance companies like Medicare don't get bulk discounts and things like that. So lobbying costs, this is just people from a lot of these companies arguing with politicians and connecting with politicians and trying to persuade them on certain policies. That's really all that is. So why are medications even being prescribed? Well, there are more drugs on the market to prescribe, and everyone's got to make money. We all got to eat. So there you go. But also many diseases are more prevalent now. Okay, we come up with many of the diseases that we have are chronic diseases, and those do require many medications which have a lot of side effects. And a lot of these chronic illnesses that we do have, they lead to other diseases, okay, like obesity. There are many illnesses that are associated with obesity. Okay, there are many, like if you have high cholesterol issues, there are going to be many other diseases that are going to stem from that high cholesterol problem. Okay, and then of course there are going to be side effects as well to the medications that you have. So how do we fix those side effects? We get medications. We get more medication. Yay! So anyway. Medication likes to keep up with science. It likes to keep up with where we're going, in healthcare. So really, with anytime we invent new technologies and new things out there, new medical technology, medical devices, when we come up with treatments and cures and things like that for certain ailments, for certain diseases, there's always going to be more medication, because medication is definitely going to follow where we're going and what our medical needs are. Okay, so physicians' prescribing practices are definitely another influence. Okay, the pharmaceutical companies usually they give incentives to physicians for prescribing certain medications. So a physician, I'm sure they want to make as much money as they can, right? So if you're going to give some sort of monetary incentive to prescribe a certain brand of medication for all of the, the cholesterol patients or all of the heart patients or whatever, you're going to do it, okay, because you're going to get that money. So you're going to try to make sure that many of your patients are taking this. Whoever might need it is going to get it, okay? And then there are better marketing by drug companies to physicians and consumers and things like that. You'd be surprised, actually. I know everyone sees all the medication commercials on TV. That goes into the marketing budget. That's a big deal, but that's a tiny little fraction of what these companies spend on marketing. Okay, that's like a dot of what they actually spend on marketing. That's not where most of their marketing dollars go to. They spend a lot of it on other influences, like influencing the physicians, right? And people like that, other people of importance who can get that medication to the consumers. Okay. Okay. So next we're going to look at what pharmacokinetics is. So pharmacokinetics is the study of how a medication moves through the body. Okay, and the reason why this is important for us to look at is because everybody is going to be a little bit different. Okay, all of our bodies are very unique, and we respond to things a little bit differently. While it generally may, for the most part, do what it's supposed to do, everyone is going to experience it a little bit differently. Sometimes your drug kicks in a lot sooner than it does for other people. Sometimes it works to a high degree. Sometimes it you might barely feel a difference. Sometimes you have side effects, right? Sometimes it does nothing. Okay, so studying pharmacokinetics is pretty important. Okay, so we just kind of know exactly how it responds to different people. Okay, and what might be happening with people. So there are 4 different things that we look at when you look at pharmacokinetics. Okay, so the first would be drug absorption. Okay, how it's absorbed by the body. Okay, how it gets absorbed into the bloodstream. Okay, and then distribution, how it cycles through the body. Okay, then metabolism, how it gets used and broken down. Okay, and utilized and all that. And then drug excretion, and this is how the body eliminates it. Okay, how does the body get rid of the drug? Okay, so those are the different steps that you need to look at and see how it works with the body and what the effect is on the person. Okay. Okay, so what is the OTC dilemma? Well, first of all, OTC stands for over the counter. Okay, so I'm going to put that right here. Over the counter. Okay, so over-the-counter drugs. How do drugs even get classified as over-the-counter or requiring a prescription? Okay, and so what is the regulation behind this? The FDA is actually the organization that deals with this. Okay. And so what are the qualifications for an over-the-counter medication? Okay, Well, the FDA will allow medications to be over the counter, okay, if they fulfill certain criteria. So basically what those criteria would be, do the benefits of this certain medication outweigh the risk for most of the people? Because if there is risk, then it is too risky to put it out there and allow patients to purchase it without a physician's supervision, right? So if it outweighs the risk for most people, then it's okay. If there is very little potential for misuse and abuse of this particular drug, because many drugs out there, you can very much abuse them, and you know that you can be very destructive with your medications, okay? That's kind of why it's, you know, it's pretty risky to allow people just to have drugs without, you know, prescription. So if there is potential, the potential for misuse and abuse of a particular drug is just very low, then it's fine. Then most likely it's, you know, who's gonna do anything? It's fine. Anyway, so if consumers can use them for self-diagnosed conditions, if it's perfectly, you know, it's fine, it's safe, you can diagnose yourself, you can go, oh yeah, it looks like I have a cough, or I feel kind of stuffy, maybe I, you know, am allergic for something. You can get some over-the-counter Benadryl or whatever. So it's perfectly safe for you to just self-medicate, diagnose yourself, and you're fine. Nothing's gonna happen to you. Also, if it can be adequately labeled, which is, of course, that's important, and also if consumers can safely use these without a doctor, which is kind of the point, okay? So, prescription drugs, on the other hand, do not pass the previous criteria, right? So the FDA will approve them, but they have to be monitored. They approve them and they monitor them just like they do with over-the-counter drugs, but you know, these drugs have to be supervised, okay, because there is more risk with these particular drugs. That's really the only reason why we can't just like put them all on the shelves and let you just, everyone just get whatever they want, okay, because people can abuse them very much. Can you imagine if we put like opiates on the, you know, on a shelf and just let people purchase whatever they felt like, you know? So that is why it is necessary to have a physician and whatnot. So the FDA goes through, filters through, monitors, and figures out what can be used over the counter, what, you know, what's safe, and then what has a lot of risk involved and needs a physician. Okay, so the FDA has approved over 10,000 drugs, okay, to date, and they will, I'm sure, continue to approve drugs and put them where they need to go, right? So, prescription drugs, drug usage in 2010, in 2010, so some of the most popular or most used drugs of 2010 were, first of all, cancer drugs. Okay, so that made 22 billion in just in 1 year, 2010. Okay, and then respiratory drugs at 19 billion and lipid regulators at 19 billion. This is just to give you an idea of the pharmaceutical industry. There's a lot of money in it. Okay. So generic versus brand name drugs. So generic versus brand name drugs. So usually what happens is when a drug comes onto the market, okay, or a new drug is developed, a new brand drug, it's going to be extremely expensive and they're going to put a patent out there, okay? But this patent is usually only, it's only in effect for 20 years. So after it's lifted, okay, after 20 years later, then a generic version of that particular drug can be put out into the market. Okay, so Generic drugs have to basically be the same drug. Okay, they have to have the exact same ingredients, they have to meet the exact same standards. It's just generic. It's just another company is gonna copy the original. That's really all it is. So it's the same exact thing. It's the same thing as like, you know, getting Listerine instead of, you know, Walmart version of Listerine. If you look at the ingredients, the active ingredients and even the inactive ingredients are usually exactly the same, right? So it's the same thing, except you get to pay a whole lot less for the Walmart one. Okay, so generic drugs will cost between 30 to 80% less than the original brand name drug. Okay, and so anyways, at this point, about half of all the prescription drugs have generic versions. Okay, but usually if it's a new one, it's not going to happen. There's a patent on it, and we're going to have to wait for a while. Okay, so what is polypharmacy? So this is the practice of prescribing people multiple medications to a patient, especially when there may, well, what happens tends to be a lot of overlap. Okay, so this usually happens, and this is very common in older adults, okay, is that they will be prescribed multiple medications for maybe one ailment, okay, or like just the one same ailment, or they, you know, and you know, sometimes, you know, it works. Sometimes it's the right thing for patients and they need this to control their diseases. However, sometimes it's not. Okay. So when people consume more drugs, then a lot of drug interactions can happen, okay, with increased frequency. And then these interactions may increase or decrease the effectiveness of one of the drugs or all the drugs. Okay, so things can happen, right? Changes in effectiveness can be caused by another or a more pronounced manifestation of a drug, okay, of having a couple different drugs, especially if they have like a similar side effect. Okay, so we won't get too much into detail with this, but generally this can, sometimes it might be the right thing to do, but many times it may have an adverse effect on the patient. Okay, so, and what this isn't always just the same physician, okay, prescribing a ton of drugs for that one patient's single ailment. Okay, this usually happens when the patient is seeing multiple different physicians, maybe for different things. Maybe their primary care physician, and then they have like a specialist that they go to, and then things like that. And so they're both prescribing, you know, their drugs, but the thing is there's no communication, okay? There's no coordination among all the different physicians that this one patient is using. Also, the patient might be, you know, they could go into the ER, they could be admitted to the hospital, and then the physician that they see in the hospital is also prescribing them something for their condition. You know, and that physician may not have any idea that this patient is taking certain drugs, and that could just be because maybe the patient, they don't know what they're taking. They could just, they could be forgetful, okay, and whatnot. And since we don't have like really efficient coordination among different facilities in this country, there's a lot of overlap. We have, so things don't always get recorded. Also, just many different physicians and whatnot many times they don't communicate. If they're not part of the same network, they might not communicate, and the physicians will not have access to that patient's, full medical history. So they don't know exactly what is being done for that patient. And if the patient can't explain it to them, then they don't know what else to do. They're just like, well, you have this disease and you're going to have to take this for it. So things like that can happen, and it happens most often in older adults because they do get hospitalized a lot more. They see a variety of different physicians. They may, they usually always have at least one chronic disease present. So, things like that will happen. So some things that they can do to sort of help themselves and make sure that, this doesn't happen to them is always use the same pharmacist, because at least if your pharmacist knows what you're taking, they have that record. Okay, so maybe your pharmacist will be able to catch that. Okay. Also, physicians and healthcare providers really need to ask their patients exactly what they're taking and try to get all the information from them. Okay. So anyway, so drug interactions. When does this occur? Okay, so you have a drug on drug interaction, and this is when one drug will affect a chemical in the body that either lowers or raises the blood level of another drug. Okay, so that this drug will affect another drug basically and make it maybe more pronounced. And so now you're going to feel it and it'll be even more intense than it should be, or it could even lower it so it won't even be effective. And if you depend on this drug for your chronic illness, then that's not good. Okay, then there's drug alcohol. Okay, drug to alcohol interactions. And this can make the drug, same thing. This can make that alcohol, what alcohol does many times is, the thing is our liver has to, our liver will kind of bypass everything. Okay, whatever you have in your body, it'll put it aside because alcohol comes first. It wants to break the alcohol down first. So if you have anything else in your body, it's going to put that aside, ignore that for a while, and it's going to work on the alcohol first. Well, since your liver's busy on the alcohol, the other drug or whatever else you have in your body, it's going to be metabolized in your body and absorbed at high amounts because it's not being broken down. So you're going to have larger amounts in your body to deal with, or you could have less. Okay, and there could be other reasons why you might have less, but when there's more, usually this is the reason why. So now you have, alcohol might allow that particular drug to stay in your system longer than it normally does, and it might be way more pronounced. Okay, or, so it could be way more intense, and it could cause, a devastating reaction. Okay, that's why certain drugs, especially some drugs are very strong, more intense, and that should never be consumed with alcohol. Okay, because you could have something bad happen, you could even have a seizure. But then sometimes the alcohol will make it even less effective. I'm not sure about the science behind that, but it tends to do that as well. So I feel like maybe there's another chemical reaction going on. Anyway, next we have a food-drug interaction. Okay, so, and usually this has to do with, are you taking this drug on an empty stomach or full stomach, and how it should be taken? Because there are many drugs out there that will make you very nauseous and start throwing up. And then when you take that drug on an empty stomach, and then you throw up that drug, and there's nothing there, right? And then, or other things can happen as well. Sometimes it absorbs in the body a lot better if you have food. Or sometimes you should actually take it with no food, because it would absorb a whole lot better without food. Okay, and then there's drug-herb interactions. Okay, so sometimes you take a natural remedy, or a supplement or vitamin or something like that, but you also have your prescription drug. Well, sometimes it could cause a reaction and you're going to get something you did not expect or you did not want to happen. Like, for example, with ginkgo biloba and consuming that with Warfarin. Okay, that will cause blood thinning, which is not what you're trying to get, okay, at all. And then sometimes you can have a drug-herb interaction where basically like the herb is going to cancel out the drug. Okay, so, and if you depend on that drug, then it sucks because now it's not working. An example of that would be like, I know during chemo, there are certain things that you should not consume because it will interfere with how chemo works on the body. Okay, so let's move forward. All right, so adverse drug effects. Adverse drug effects. So an adverse drug effect is when there's an undesired or unexpected reaction produced by the medication, okay? And this actually accounts for up to, or may account for up to 100,000 deaths per year, okay? So it's pretty significant, pretty unfortunate. And why does this even happen? Well, many times it could just be prescribed as a mistake, or maybe an allergy, or you had a sensitivity to a drug, okay? Or the way that, or there may have been interactions with how that person consumed that drug, okay? So human error accounts for many of the adverse effects. So like I said, that would be misuse or medical error, mistakes, okay, or maybe mistakes on the patient's part. Maybe they consumed the drug with something that they shouldn't have, and there was an adverse drug reaction, okay. Older adults actually have greater risk for adverse effects, and many other reasons why is because, again, sometimes things can be prescribed by mistake. Because if a patient or the older adult patient is already taking a drug for a particular disease that they have, and then they're prescribed another drug for that, there could be some sort of drug-on-drug interaction that will result in some adverse drug effects. Or it could be that there have been, or it could just be medical error, because since they do go see, they're seen at they use hospitals more often, they see more physicians. So anytime you do have a lot of, interaction or a lot going on in the healthcare delivery system, so you're going to the hospital quite a bit, or you're seeing a variety of different physicians and whatnot, that just puts you at risk for misuse, okay, for medical error, okay. Anyway, there are many side effects out there that we don't actually know about, or that are unknown until the drug really is on the market. And this is, anyway. Okay, so next we need to look at medication errors. Okay, so just everyone makes mistakes, we're all human, and humans make mistakes in handling drugs, preparing drugs, administrating drugs. Okay, so there are many steps along the way in which people can make mistakes. So it is kind of important for the patient to also be informed and to be smart about the drug handling as well, because you're putting stuff into your body. So anyway, the 5 rights of drug administration is having the right drug, okay, having the right dosage, having the right route, okay, the right route that it's going to take, having the right time, for the patient to take the drug and the right patient. Okay. So these are the 5 rights of drug administration. Now, patients can assist in their medication administration. So how can they do that? They can, first of all, you can make sure that your nurse, the nurse properly identifies you, okay? Or your nurse or whatever medical professional that you're dealing with is properly identifying the patient, okay? Then you can ask the nurse what medication is being given to you or to the patient and why is it even being given, and also ask about how much of the medication was ordered by the physician and how often are you supposed to receive the drug, and by what route is the medication supposed to be given. So is it going to be a pill? Is it injection? Is it an IV? Okay, so there's just some ways in which you should the patients can get familiar and to speak about, or with their healthcare professional about like what you should do to reduce medication errors. Okay, then we have compliance issues. Okay, so sometimes people don't want to do what the doctor says. Okay, and I get that. Okay, I mean sometimes I don't like to do that as well, but you you know, if you're going to go, I don't want to say you should not comply with the doctor's orders, but you should always at least educate yourself before you're even going to do anything, okay? And probably tell the doctor you're not going to do what they're saying. So at least they know what's going on with you if something happens, okay? But anyway, so not complying with your physician, with physician's instructions regarding prescriptions is called non-compliance, okay? So there's intentional non-compliance and then there's unintentional non-compliance, okay? So intentional non-compliance is usually because the patient wants to save money, or they reduce, or they want to reduce the risk of having side effects, or they already feel like they feel better, so why do I need the medication, right? Well, and then unintentional non-compliance, it might be because you just don't know, okay? Lack of knowledge, you don't know what you're supposed to do, okay? Or it could be you just forgot, okay? So it's important to understand why an older adult is being non-compliant with their medications. Okay, is it unintentional, not intentional? What's the reason? And so instead of just blaming the patient and just calling them non-compliant, you need to figure out exactly what's the issue there. Many times, what may be the issue, and what I have seen, is that the medications are just too expensive, and a lot of older adults have a lot of prescriptions, okay? So there are sort of many times, because Medicare Part D has caps. Medicare Part D is not necessarily the best. It doesn't cover everything, and there may be a lot of out-of-pocket costs that are not going to be that the patient's responsible for. And sometimes the patient cannot afford that, okay? So in order to save money, they might not pay for it, or they might even, I've seen some where they like reduce their dosages, okay? Because they're trying to make their medication last a lot longer, because they're saying maybe they can reduce not pay for like 1 or 2 months out of the year for a certain medication. So they're trying to see if they can make their medication last, throughout the year. Unfortunately, that's how things happen. So I've seen that quite a bit, and I think that is a little bit common. Anyway, let's move forward. So, okay, so here, so education to increase compliance. What can we do? Health professionals, you need to make sure that your older adult patient understands exactly how to administer their medications, and that they can administer their own medications. Check for to make sure that they understand, what the instructions are and things like that. So sometimes it's good to ask them to repeat it back to you and repeat back the instructions. Expect to spend a little bit more time answering questions when working with older patients, and consider using non-child-proof caps for older adults, okay? Just so it's a lot easier for them to administer their own medication. And then have handouts that patients can refer back to, so just, literature that they can go through and check and all that for their medication needs. Next, memory aids to increase compliance. So older adults often take multiple prescriptions and find it very difficult to remember all the multiple prescriptions. So all the differences, what does what, So there are many ways that we can help them remember to take their medications. Some things you can do, or that they can do, is have their medication placed next to a toothbrush or something that they're definitely going to use out of habit on a daily basis, okay? Also, have them take their medications with meals. Again, meals are a daily thing. That's a daily habit. So if you always take your medication whenever you have a meal, well, how are you going to miss, right? Organize your pills by weeks or by months. It's really cool, like all, those pill organizers, that helps a lot, okay? So for older adults especially, to have all their pills just, out like that. I actually use one of those, not for all these different pills and medications, but for vitamins, because I find it really annoying to have to open up a cap and all the different vitamins that I want to take, and it's just so much easier to open the little flap of the vitamins that I already placed in there for that day and just to take the vitamins like that. So those are very useful. Anyway, next, enhancing oversight of drug therapy. Okay, so what is the physician's responsibility? They need to understand more about how to prescribe medications to elders. Many times they don't really take the time to break things down, to figure out if the older adult, if the older patient understands what the medication's for and how to administer it to themselves. So the physician is their responsibility to, help them with that. Also, pharmacist's responsibility. What's their responsibility? Well, they need to help with drug interactions, okay, and they need to, and also polypharmacy. So remember what those concepts were. When a patient might be taking more than one drug for just one particular ailment, and there can be many drug interactions that could have adverse effects. So the pharmacist, especially if the patient is going to the same pharmacist, the pharmacist can see in their records all the different medications that they have, so they can check up on that and go, hey, wait a second, looks like you're taking this and this, you should not be taking this in addition to that. What is the nurses and social workers' responsibility? They need to answer questions and have better patient connection, okay, and history with the patient. They need to know their patients a little bit better, okay? And then what is the older adult's responsibility? They need to actively just seek information and answers for all their questions, okay? So, medication information resources. There are many resources where you can go to get a lot of information for the medication that you are using. That being said, many older adults are not going to go online, but there are government websites out there, the FDA, National Library of Medicine, National Institute on Aging. Many professional organizations will have their site out there that also answer a lot of questions on medication and have information on medications. Obviously, there's Google and things like that. But what many older adults will probably prefer would be to ask their physician. So of course they need to make sure that they have their physician's number ready, available, so that they can go ahead and get a hold of them to get answers about their medications. Okay, so alternatives to drugs. If you're not a fan of eating pills all day, the best thing you can do is stay healthy. Okay, exercise, keep yourself at like a more, a healthy body weight. I'm not saying that you need to be completely like skinny. You don't need to look like a model or anything like that. But keep yourself at a nice healthy weight where you feel good, you can move around, it's not really affecting you, and it's not causing you any kind of diseases. Of course, quit cigarette smoking if you do that, because that causes a lot of chronic illnesses, or it can lead to many other chronic illnesses. Using dietary changes, you know how they say let food, or that one great philosopher said, let food be thy medicine and let medicine be thy food. It's very true. Change your diet, eat very healthy food all the time. Even you can take herbal remedies are great, and are kind of the primary medical treatment for a lot of people. It's actually majority of the world goes straight to the herbal remedy before anything else. It's usually just the more developed countries who go like, no, modern medicine and science, we like that better. But no, a lot of the world goes straight to the herbal remedies, the food, the stuff that our grandparents tell us to do, things like that, and it does wonders. Okay. Also, the FDA does not necessarily regulate herbs, vitamins, and things like that because they're considered food products. So that may or may not be a good thing, but they are considered food products, so they also may not be as, they may not have dire effects. So anyway, that was the end of lesson 8. I hope that you learned a lot, and if you have questions, please let me know. You have the comment section below. You always have my email and number and all that.